Watson Clinic Women's Center is 2 suites. The first suite is Suite A, the mammography suite, that has breast mammo and ultrasound. The biopsies can be done over there, and core biopsies, aspirations, and it's kind of one-stop shopping. Suite B is surgical to include the plastic surgeon, and we do plastic surgery consultations for complete care of the breast care patient. Now, one thing that's very unique about each suite is that each suite has a breast navigator that is important for each type of situation. A navigator to help them through the breast mammo, ultrasound, and diagnostic part, and a navigator to help them through the surgical part. Digital mammography has been really important to our breast care patients. It helps to get a more clear picture in a more rapid fashion. We're now uncovering smaller lesions in a more timely manner. It is more comfortable to the patients, we believe, and perhaps maybe even a little bit less compression. So overall, it's a bonus for our patients with a faster, more clear, more comfortable imaging technique. The breast cancer patient at the Watson Clinic is given a number of different diagnostic techniques, including breast MRI and perhaps the special breast imaging, BSGI. As well, that patient is presented at a multidisciplinary breast conference with many doctors sitting around the table, the pathologist, the radiologist, medical oncologist, the radiation oncologist is there with the social workers and the nurses to discuss their problem, to optimize their care. And this is very important. A lot of women, when they discover a breast problem, such as a lump, panic, and rightfully so. It's a very unnerving situation, and they'll jump into conclusions that the lump has to be removed right away. And that really leads to suboptimal care in many situations. You can take a deep breath and you can relax, and you can get opinions and get evaluations in a thorough manner to optimize your care. You don't need to jump into anything, especially don't jump into mastectomy, because that's not necessary in most women these days. A patient that has an abnormality detected on their mammogram will be asked to come back and have additional imaging. They'll have more views on the mammogram to see if this is really kind of a real thing or a fake out. If a real problem is detected, they will go on to ultrasound to determine if that area is a solid lesion or a cyst. A cyst can be aspirated. A simple cyst is no problem. It's like a water balloon. Or a solid lesion needs to have a needle biopsy performed, and they will be walked through that by the nurse navigator at the Suite A. Most women can have a needle core biopsy first and not have to go to surgery. In fact, many women will never have to have surgery, can avoid surgery by a needle core biopsy. If a patient is encouraged to have an area removed by their surgeon, they probably want to think about a second opinion if they haven't had a core biopsy, because the problem may be a benign one, and then they don't need to have surgery with anesthesia and problems that can be associated with that. They don't need to have a scar on their breast that may further compromise their mammograms. So overall, it's very important to find out why the excision of a lesion or the removal of a problem is being recommended if you don't have a diagnosis.